In this lecture, we will be discussing diseases of the liver. We've already learned at this point that the liver plays an essential central role in metabolism and storage of many nutrients. The liver sits in a unique position in the body and receives blood supply from the heart like other organs. But it also receives blood from the portal vein system, which collects blood from the intestine that is nutrient-rich from nutrients being absorbed into the bloodstream. In this figure here, we can see the set of blood vessels from the heart that is supplying the liver with blood. Also, we see this nutrient-rich system that the blood is going into the liver for metabolism and eventually transport. And this is the portal system. Also, in previous lectures, it has already been mentioned that the liver is an organ that's responsible for making bile. There is a separate vessel system in the liver that is for bile secretion into the gallbladder for temporary storage. Like some other organs, the liver tissue is made of a functional unit called the lobule. Another example of this type of structure is in the kidneys, and the kidney's basic functional unit is called the nephron. These structures are very similar. So, each lobule has a central hepatic vein, which is the vein that ultimately takes the blood back to the heart. Then radiating out, we have between the hepatic cells, there are these spaces for the blood. And the liver is a very blood-rich organ in terms of blood flow. This is the reason why that if there is an injury of the liver, such as a puncture wound or a gunshot wound, they will bleed really badly, and it would likely be fatal in many cases. Also in this system, we have the hepatic portal vein. So we see that over here. Again, this is the blood that collects, or the blood vein that collects blood from the intestines. The blood flowing in the portal vein will have more nutrients, so the blood goes through these areas between the cells, and then these cells receive the blood from the portal vein. They pull out the nutrients they need and eventually send the rest of the blood into the hepatic the central hepatic vein, where again it goes back to the heart through the vena cava. Here is another view of the circulation through the organ of the liver. We see the hepatic artery and the hepatic vein. So this is the regular circulation here. So let's point these out. Here we have the hepatic vein, the hepatic artery. So this circulation here is the regular circulation from the heart and then back to the heart. So this is no different than any other organ tissue that relies on the heart for blood supply. What is unique for the liver is this part here. This part where the portal vein system. So this is the system that collects blood from the digestive system, from the stomach and the intestine. This is where the water-soluble nutrients are absorbed here, and then go to the liver first. So please pay attention to this. From the stomach and the lower GI, so the small intestine and large intestine, all of them go back up to the liver first through the portal vein. So if for some reason there's resistance for the blood flow and the blood cannot easily flow into the liver, as we see in cirrhosis when we discuss that later on. This is a condition called hepatic portal hypertension. With that, blood would be backed up, causing the blood pressure to be high in this section. So right around there, and eventually it would start putting backing blood up into these veins, and then eventually it causes a condition called varices. Basically, due to the accumulation of an abnormal amount of blood in the walls of the GI tract, the veins get abnormally large and could even break, which could cause it to be a fatal condition. The main function of the liver in terms of digestion and absorption is to secrete bile. We know that bile is an emulsifier for fat digestion. It is not an enzyme. Bile acids are not enzymes, but they do help to disperse fat molecules into small pieces in a watery environment to increase the surface area that can be in contact with the lipase molecules. This is the function for helping digestion of fat. And the digestive product of lipids needs to be absorbed into the lymphatic system first, and this absorption can be facilitated by bile acids, which form micelles that help carry the products of lipid digestion to the brush border and get across the microvilli into the cells. Another function of the liver is that it is not only the site for synthesis of bile acids, it is the essential station for enterohepatic circulation of bile. So this one right here. We know that bile will be released by the gallbladder to the duodenum and then eventually travel down the GI tract. So here it's getting let go and going down the GI tract. But eventually the majority of the bile acid molecules are reabsorbed back in the colon. From here, they go through the hepatic portal vein back to the liver, and they will be recycled into new bile to go back into the gallbladder. So this is what we call the entero, again, entero meaning intestine, hepatic meaning liver. So this is the circulation or the recycling of bile between the liver and the intestine. Recall what you likely learned regarding fiber and advanced nutrition. To disrupt the enterohepatic circulation is one way that fiber can lower cholesterol. This is because our liver uses cholesterol to make bile acids. So with a high fiber diet, it would delay the absorption of bile, and this would cause more fecal loss of bile, which in turn will force the liver to convert more cholesterol to bile acids, leading to a decreased cholesterol level in the system. Other major functions of the liver have been covered in previous courses, and this here is a really good summary. It really plays a very essential role in nutrient metabolism, both of macro and micronutrients. Also, the liver synthesizes a lot of useful proteins and releases them to function elsewhere. For example, albumin, prealbumin, CRP, they are all made in the liver, but they don't function in the liver. They are released into the blood to go to the sites where they do function. The liver is also the site for ketosis. The keto molecules can be used by our brains in starvation. So this is also something the liver does to process them and then sends them out. Also, there is the synthesis of VLDL and the clearance of cholesterol by HDL. So again, it's a very important organ. To assess liver function, we may have many tests since the liver has many functions. The tests could be non-invasive or invasive, but of course we would always prefer to have the non-invasive test if possible. These tests could help us identify which type of liver disease the patient has and what part of the liver function has been compromised. So the monitoring of these lab markers could help us determine how severe the disease is and predict a prognosis in many cases. We can classify the liver functions into categories of detox, biosynthesis, or coagulation. Remember, the synthesis of coagulation factors occurs in the liver where there is a high level of vitamin K, which is also important in the coagulation process. Here is a summary of some of the common tests that are used to assess liver function. In the blood, we check ammonia levels because the liver is the organ for urea synthesis, and if the liver function is normal, we should not have a high ammonia level in the blood circulation since we can convert it to urea and dispose of it in the urine. However, if the liver function is impaired, then the nitrogenous waste from amino acid metabolism will be present in the blood as ammonia. And ammonia is a neurotoxin which could damage the brain and even cause the patient to slip into a coma. Obviously, this is something important we should be checking for. Also, we can check for serum cholesterol, which is also a function associated with the liver. Then we have the protein tests, including albumin, total protein, and CRP, the inflammatory marker. Also, we see here prothrombin time, which is the test for the coagulation process. So people with liver disease or vitamin K deficiency could have abnormal values of this. As far as urine tests, remember that we mentioned in gallbladder disease that if a gallstone blocks the flow of bile, it will force the liver to dispose of some of its metabolic waste into the blood. Then this would end up in the urine, and the marker for this is bilirubin. And this will actually make the urine abnormally dark, and the feces we'll see will become grayish like clay. So in this slide, we can see the color of the stool can also tell us information about the liver function. Then we also have the liver enzymes, which are commonly used to assess liver function. Because the liver is so active in nutrient metabolism, these enzymes, such as the transaminases AST and ALT, occur at much higher levels in the liver compared to other cells. Therefore, if we detect a high level of these enzymes with blood tests, it most likely means that our liver is damaged. And this is because the liver cells have died and released these intracellular enzymes into the bloodstream. Other tissue damage could also lead to an increase in these enzymes, so we cannot solely rely on these markers, but we'll have to do an additional test, maybe several additional tests, to distinguish between different diseases.